Hi, today we're here with Dr. Brandon Webb, who is specialty is infectious disease, and we are talking about flattening the curve and stopping community spread. So if you have any questions for him in the meantime, you can go ahead and put those in our live comment section and we'll answer them throughout this live. But Dr. Webb, do you want to talk to us about what flattening the curve means and kind of explain that to us?
Absolutely. Do you mind if I draw a little bit?
Sure.
Okay. Let's get that up. So this is a really important concept for people to understand because it can really bring us together as a community. So the curve we're talking about is the epidemic curve, which simply is the number of new cases per day. Mm-hmm. At the beginning of an epidemic, the curve is very steep. And that's because we currently don't have any immunity in the community to this new infection. It's so steep that it can actually double the number of cases in every couple of days. And we're actually in the steep part of the curve right now. The curve peaks when the infection has affected as many people in a community as it can. Okay. The important concept here is that we can modify the shape of the curve. And we can do that by doing things like social distancing.
And can you explain to the public what social distancing is? What's the simplest terms of what that actually means?
Absolutely, yeah. So social distancing, simply put, is three things. One, it's staying home if you're sick. Two, it's avoiding all unnecessary public activities. And three, if you do need to be around people, it's keeping your distance between at least 3 to 6 feet away. And if we do that, what we can do is actually modify the course of an epidemic so that instead of having a surge of cases all at once, we can spread the cases out over time in our community. And the importance of that is that when we have surges like this, it can overwhelm our healthcare system. And our hospitals and ICUs are normally full of people who have acute conditions that need care. During an epidemic, those patients are still there, and yet we have all of these new patients. And we need to do everything we can as a community to avoid overwhelming an already busy healthcare system.
Yeah, so if you were going to give some examples of what people can do to practice social distancing at home, at work, with their kids, like what are some good ways that people can really make sure that they're doing that?
Yeah, so first is to evaluate whether activities are necessary or not. Mm-hmm. Essentially, all large public gatherings are not essential. We need to avoid those. And even small group gatherings, if they're not necessary, we need to find alternative ways of connecting. Social media is a great alternative method. If you do need to go out in the community, for example, to go to the store, you can do things to protect yourself in that setting as well by making sure that you're avoiding close proximity to other people. And by paying close attention to not touching your face, to doing good hand hygiene, washing your hands, using hand sanitizer, things like that.
So another big thing that happened over the weekend was that this is the first day that school shut down. So can you kind of talk about the effect of this and what other measurements that we can take now that our kids are potentially not in school? How can we instill this message of social distancing to them?
Yeah. This isn't a vacation time. Social distancing is the single most important thing we can do to pull together as a community to modify the course of the spread of coronavirus. And so now that the kids are out of school, it's important to pay close attention that we're not duplicating things that happen in school out of school. So avoiding large gatherings. It is good to be outside. Mm-hmm. That's good for people, good for kids, but keep your distance.
So we just had a question come on from Melissa who asks, won't this prolong the disease if we're treated over months instead of weeks with flattening the curve? Can you kind of explain that part?
Yeah, that's a great question. It won't necessarily prolong the disease because when it surges, we actually have a huge number of cases in the community all at once, mm-hmm. and those cases take a lot longer to deal with. We're better able to deal with the epidemic if we can flatten out the curve and deal with a reasonable number of cases over time.
Yeah. And we just had another question from Chantel who asks, can you recommend groups of less than 10 people to congregate like the White House just announced?
Yeah. We've heard a lot of numbers thrown out there, 100, 50, 10. The point is that this is a disease spread person to person. And so the principle is keep your distance. Mm-hmm. You could have 1,000 people in a large area and they could all be 10 yards away from each other and there'd be very little risk. But avoiding groups helps us to stay farther away from people.
Yeah. So what does community spread mean to me as a community and also as a potential patient? Like, how is helping this slow down going to impact me and those around me?
Yeah. This is very much a community endeavor. And what we're trying to do is shift culture, which isn't easy. Mm-hmm. The coronavirus epidemic is very much a public health issue. And by doing our part, with everybody chipping in, making this a part of our daily lives, we can actually protect those in the community who are most at risk for having severe disease or death.
Yeah. Is there anything else you kind of want to talk about today with social distancing, community spread, flattening the curve, anything else that pertains to this specific topic?
I would just reiterate, this is the single most important thing we can do. None of us have immunity to coronavirus. We have very limited treatments available. And the name of the game right now is prevention. And the way we prevent is by keeping our distance from other people.
We had one last question come in that we'll answer today. Holly asks, what about hospital employees and their inability for social distancing? How are they protected?
That's a great question and one that hits close to home for me. We're in the trenches and we need to do everything that we can as a healthcare community to protect the workforce. And so because we can't keep our distance, we use personal protective equipment to keep barriers between us and other coworkers and other patients.
So if you have any specific questions or concerns about COVID-19 and want to get more information, you can call our Health Answers line at 844-442-5224. Again, that number is 844-442-5224. Thanks, guys. We'll talk to you later.
Thank you.